With a new school year around the corner, states are drafting reopening plans that look to protect students and faculty as they head back to class. For states that have in-person learning in their arrangements, school nurses will be on the front lines in new roles as the country continues to deal with the pandemic. For more on this, I'm joined by Melanie Asmar. She's a reporter for Chalkbeat Colorado. Melanie, thank you for joining us.
Thanks for having me.
So where you are, you write that many school districts lack full-time nurses, and some often serve several different schools simultaneously. Can you tell us a little bit more about that?
Yeah, here in Denver, only 15% of the schools have a full-time nurse. The rest sort of share nurses. So one nurse might cover like 3 different schools and only be at one school 1 day a week or 2 days a week.
And that seems different from when I went to school. I'm wondering if this has been the result of budget cuts and more of a trend in education across the country. Can you tell me a little bit more about that?
Yeah, I do think that the shortage of school nurses does have to do a lot with funding. When education funding gets cut, schools and districts have to make really tough choices. And recently, at least here in Colorado, a lot of schools have prioritized students' mental health needs. So they've been hiring more school counselors, more psychiatrists, psychologists, and sometimes, unfortunately, that means that the number of school nurses gets reduced.
So what impact could this shortage of school nurses have when students actually do return to classes?
Yeah, well, a lot of schools and districts have sort of infectious disease plans of what to do if there are outbreaks. And a lot of those plans rely on school nurses to sort of spot outbreaks and to work with local public health departments to respond to those outbreaks. And so if there isn't a school nurse there 5 days a week, that job often falls to someone else like the principal or sometimes a nurse's aide or sometimes even the school secretary who don't have that medical training.
I imagine that that's a particular concern as we're dealing with a global pandemic and how to best bring back students and faculty to schools, huh?
Yes, definitely. I think this has really, COVID has really sort of heightened the awareness around this. And I think it has sparked several districts across the country to take a look at their school nursing staffing levels and try to make plans to address it going forward.
And Melanie, we've learned over the course of this pandemic that Black and brown communities have been disproportionately affected by the virus. I have to wonder, obviously, if these communities are also those that are experiencing a shortage of school nurses. Yeah,
well, I think, again, it all sort of ties back to funding. So in districts that are underfunded, and many of those serve, students, a high proportion of Black students, Latino students, those are the districts that would be probably hardest hit by this shortage.
Outside of dealing with potential COVID-19 cases, how important are school nurses when it comes to the school system as a whole?
Yeah, I think nurses are very important. In addition to dealing with students who are sick, they also care for students who have health conditions. So, I spoke with one mom here in Denver back when this all started about her school. She specifically takes her 6-year-old daughter to a school outside of her neighborhood because that school has a full-time nurse. Her daughter has type 1 diabetes, and she really relies on the school nurse. It gives her peace of mind to know the school nurse is there to help her daughter check her blood sugar. And she told me the school nurse has apple juice boxes like stashed all around the school to help her daughter if her blood sugar gets low. So in addition to responding to disease outbreaks or sick students, nurses do a lot of sort of day-to-day caring for students with health conditions.
So, Melanie, given how important your reporting has found school nurses are on the front lines of the pandemic and also for students who have other health needs, what are you finding when it comes to this question about returning to school? Can schools operate safely without school nurses, given this shortage?
Yeah, I think it definitely makes it harder. I think parents parents would be a little more confident if schools had full-time nurses sending their kids back to school. I know here in Denver, the district is talking about possibly asking voters for a tax increase, and possibly some of that money would go to staff schools with full-time nurses. I think other districts are also talking about trying to find funding for full-time nurses because they will be very important to respond to COVID in schools.
All right, Melanie Asmar, thank you for joining us.
Thank you so much.